Hi, everybody. This is Michael King, and I'm also joined here by Dr. Sambursky, and I hope you guys are doing fantastic. So let's jump into the questions. Anything you would want to talk about with, glare and halos or night vision disturbances, whether or not somebody, is that something that they've got to be concerned with as a long-term issue of having LASIK, or how often does it happen? So how do you address that to a patient?
So interestingly, glare and halos was a very hot button topic probably 15, 20 years ago.
Mhm.
Nowadays, that's much less common. Typically, most people will see some glare and halos in the first weeks and days after the procedure, but it typically gets better over time. And the reason for this not being as much of an issue as it used to be is that we have increased the size of the optical zone, or the diameter in which we treat the patients. We also use different lasers which kind of fan out or feather out the treatment, so there's much less of a discrete difference between where the cornea has been treated and where it hasn't been treated. We're also using customized treatments which take into account the actual, what's called the topography of the cornea. So all these different treatment modalities allow patients to have much better experience with much less risk for glare. Is it a risk? Of course, but the risks tend to be very uncommon and very small. And if we notice that people could be at risk, let's say someone has really huge pupils and a lot of astigmatism, we may counsel them, but we try and address all the potential complications and rule them out when we have the in-person consultation to let people know what's going to be good for them and what they can expect.